So the meeting is now streaming to YouTube. Is it live yet, Dan?
It will be any second, Paulina. You can get going.
Thank you.
We are live, Paulina.
Thank you, Dan. Chairman, we're now live on YouTube if you'd like to start the meeting.
Okay, thank you, Paulina. Good evening, everybody. Welcome to the Health Scrutiny Committee. I'd like to start by welcoming members of the public and press who are watching the live stream of this meeting through the Council's YouTube page. Due to government guidance on social distancing, this meeting is taking place remotely in accordance with current legislation, which makes provision for remote attendance at and remote access to council meetings. The meeting is also following Peterborough City Council's virtual meeting protocol. In order for this meeting to run smoothly, I would ask several things from members and officers. First, that you keep your video camera switched on with your microphone muted, except when you are invited to speak. If you wish to speak, then please raise the virtual blue hand, which can be located at the bottom of the participants section. I and the Democratic Services team will keep an eye on the participants list to see who wishes to speak. Please be patient if you are not invited to speak. As soon as you have raised your virtual blue hand, this may be because there are other people wishing to speak before you. The Democratic Services team will be monitoring the participants list to see if anyone has dropped out of the meeting, and will try and contact you to provide assistance to rejoin the meeting if it should happen. As with all new systems, we may run into technical difficulties, and for this I ask for your patience. Should this occur, an adjournment of the meeting will be declared while the fault is addressed, and the public broadcast will be paused. If it is not possible, the meeting will be adjourned until such time as it can be reconvened. Finally, I would remind members that all virtual meetings are recorded. Before we move to the first item on the agenda, I will begin by taking a roll call of all Scrutiny Committee members to establish your presence. When your name is called out, please unmute the microphone and confirm that you are in attendance. Thank you. So first, Councillor Ali.
Present.
Councillor Barkham.
Yeah.
Councillor Burbridge.
Present.
Councillor Hemorrhage.
Present.
Councillor Rush.
Present.
Councillor Simons.
Yeah, present.
Councillor Warren.
Present.
Councillor Kayam. Councillor Sanford. I believe Councillor Kayam and Councillor Sanford haven't quite joined the meeting, but they are due to attend in the next few minutes. Susan Mahmood is also attending on behalf of Health Watch. Susan,
Present.
are you present?
I am.
Thank you. Also in attendance is Dr. Liz Roban, who will support the committee as lead officer, and Paulina Ford as supporting Democratic Services officer. We also have other members of Democratic Services team who are supporting the meeting in the background in case of any technical difficulties. Thank you, everyone. We have a lot to get through tonight, so let's make a start. Agenda item 1, apologies for absence. Paulina?
Chairman, no, there are no apologies for absence for this evening's meeting.
Thank you. Item 2, declarations of interest or whipping declarations. Does any member of the committee have any?
I work for North West Anglia Foundation Trust, so I won't be taking part in agenda item 6.
Thank you. On to agenda item 3, previous minutes. We have 3 sets of minutes to approve, and I'll take each set in turn. So, number 1, minutes of the House Scrutiny meeting held on the 7th of July 2020, pages 1 to 10 of the agenda pack. We are being asked to approve the minutes as set out in the agenda as a correct record. Can I ask if any member who does not agree with the minutes as a true record of the meeting, please raise your virtual blue hand now. Okay, so there are no objections. We will take it that the minutes are agreed by the committee. Item 2, minutes of the Joint Scrutiny Committee meeting held on the 2nd of July 2020, pages 11 to 22 of the agenda pack. We are being asked to approve the minutes as set out in the agenda as a correct record. Can I ask if any member who does not agree that the minutes are a true record of the meeting, please raise your virtual hand now. Okay, again, no objections, so we will take it that these minutes are agreed by the committee. Last set of minutes of the Joint Scrutiny Committee held on the 22nd of July, pages 23 to 40 of the agenda pack. We are being asked to approve the minutes as set out in the agenda as a correct record. Again, can I ask if any member who does not agree with the minutes are a true record of the meeting, please raise your virtual hand. Okay, so no objections from anybody. Again, we will take it that these minutes are also agreed by the committee. Okay, on to item 4. We now move to call-ins of any cabinet member or key officer decisions. Paulina, have there been any call-ins?
No, Chair, we have no call-ins for this evening's meeting.
Lovely, thank you. On to agenda item 5, appointment of co-opted member. Paulina, can I hand over to you to introduce the report?
Yes, thank you, Chair. Yes, at the beginning of each municipal year, we review the appointments of any co-opted members to the scrutiny committees. As the report states, each scrutiny committee can have up to 4 independent co-opted members of their choosing, but one of which has to be a parish councillor co-opted member to represent the rural communities. The parish councillor co-opted member is nominated and put forward by the Parish Council Liaison Committee, And for this committee, they have proposed that Parish Councillor Juneball be the co-opted member. Parish Councillor Juneball was the co-opted member also for last year. So really it's for the committee to note the nomination and agree the nomination going forward for this year. It is reviewed annually, but at the moment it's just Parish Councillor Juneball who's been put forward.
Thank you, Paulina. So, committee members, does anybody have any objections to the appointment of Parish Councillor Juneball? Please raise your virtual hand now. Okay, no objections. So thank you. We are all agreed for Councillor Ball to join our committee. Unfortunately, Councillor Ball is unable to join us for today's meeting, but I know she'll be happy that we've agreed her appointment for another year. On to agenda item 6, the interim report on the relocation of the proposals to relocate the urgent treatment centre and GP out of hours service in Peterborough. I am aware that Councillor Hemraj will be leaving the meeting as she has already declared, and I will continue. I would like to welcome the following officers who are attending to present this report. So Caroline Walker, Chief Executive of North West Anglia NHS Foundation Trust, and Jessica Bowden, Director of Primary Care, Medicine Optimisation and out of hospital urgent care collaborative CMP CCG. Sorry about that, Jess.
I'm sorry about it too.
So Caroline, are you presenting or is Jess?
I think Jess is going to lead and then I'm going to follow through on the hospital specific bits.
Okay.
Yeah, thank you, Chair. So I'm just going to run through the paper that you've had, which is the interim report of the consultation, which has been running since the beginning of August. It finishes on the 30th of September, so please do promote the consultation for the next 9 days to your constituents. This goes up to the 7th of September. At that point, we'd had 688 completed responses in. The website had been viewed about 1,360 times, and we had 2 public meetings during this time. The report sets out at 5.1 the emerging themes. What's interesting, I think, is that when I came to talk to you about our big conversation with the public, and Jan, I think, was also there back in January or February, I think it was, there was a very clear steer from the public that they wanted to be able to access urgent treatment in one place, all services in one place. This consultation has given us a completely different view, which is something we need to really understand from what people are telling us. So back in October, November, December 2019, 72% of respondents said they would prefer to go to a single access point for advice and treatment, and where they could book in advance, which, as you know, is one of the models that we're proposing here up at the PCH site. As you can see from the respondents, actually that has changed considerably. Although people understand the reasons for what we're talking about doing, a large number, 60%, are not sure about the proposal of moving the urgent treatment centre and the GP out of hours up to the PCH site at this point in time. You'll see the different themes that have come through. There are 2 really strong ones that have come through, particularly in the free text comments that we've had of those that have responded so far. And 2 particular ones stood out to me. One was parking. People are still concerned about parking, although, as I'm sure some of you know, it's also quite difficult to park at the City Care Centre, and particularly also around COVID and nervousness about attending hospital sites. So you'll see there's also people supporting it. They're supporting reduced times of waiting. They want to see services joined up, and they they do generally support the ideas, but it's the concern particularly around parking and moving up to COVID at the moment. People are keen to be able to book through NHS 111. There's a lot of support that's come through for NHS 111 through the free text comments as well. But those are the two particular issues that we have had to go through so far to the 7th of September. And clearly those are issues that we need to think about and address. The process at the moment is that the consultation finishes on the 30th of September. We will then be reviewing all the responses and any responses we have from organisations or from the committee, and that will be going to our governing body at the beginning of November for consideration. And we'll be looking at any mitigations or changes we wish to make in response to consultation. So those are the key themes. I don't know if Caroline, you want to come in now, or whether we should wait for questions.
Yes, please. I guess based on what Jess has said there on the initial feedback from the public's opinions, takes us to some of the things the committee last time we met asked me to elaborate on. And in the paper, section 4.3 and 4.4, I've attempted with the team to take you through the public transport arrangements and the green travel plan. I was asked about our travel plan and our car parking arrangements on site. In normal circumstances, and would they accommodate the additionality in relation to this transfer? So I think in the paper I've articulated what we're doing, what's work in progress, and the current situation. There's ample car parking on the site in the current situation, and we did indeed put over 100 new spaces in just before COVID hit the country. So we think that there's adequate car parking to accommodate specifically the times of day that most of these presentations would come, and the out of hours arrangements. I guess one of the things that I can't really forecast is the public confidence in coming to the main hospital site. For sure, thousands of patients are coming every day to the site, and attendances at A&E currently are back up to almost normal levels. But there are definitely still some patients who are fearful of coming to the site. I guess I would just want to reassure the public that the site is reconfigured, and we've got areas where potential COVID patients and non-COVID patients are segregated, and the risk is minimised to the maximum attempt that we can make. And as we get the hang of dealing with this disease and coping with the patients, hopefully public confidence will become more and more increased. I mean, based as I stand today, the trust has 1,021 beds between the hospital sites that we have, and we only have 4 COVID patients in that entire bed base. So I think that the perception that there's a big, massive risk coming to the hospital site, we have it contained at the moment, and we have our red and green sites that we've got to get that message out to the public, for the current public as well as the potential public that will come once this facility transfers to the main site. So thank you. They're the comments I wanted to make in relation to that message that's coming from the public about confidence in the COVID site and the relocation. I'm pleased to hear that people are understanding the NHS 111 first methodology. That's something the whole NHS has got to get the hang of this winter, and the government are expecting us to try and encourage the public to attend with an appointment time their urgent care needs. That's something we've all got to work really hard on, because that is something that just caused pressure on the departments as they currently stand, and as they would do reconfigured as well. Thank you. Okay, thank you, Caroline. Thank you, Jess. Okay, so over to members. So Councillor Barkham.
Hi team, thank you for the report. On page 49, just clarification, it indicates that 65% of respondents would prefer how it is, or because they said that reflect the preferred use of services they already know. Does that mean they prefer to keep it where it is, or they agree with the change? And to clarify further down, it indicates that 29% of respondents agree with the proposal, but everybody else disagrees. Is that correct?
Shall I come in? So 65% of respondents at that point in time wanted things to stay as they are. That's the way I would that is meant. And so 60% don't agree. So when asked specifically about this proposal as opposed to how do you want to use your services. 6% don't agree with moving it to moving the out-of-hours space and the urgent treatment centre to the hospital. 11% unsure about that.
So would there be a percentage that would persuade you to indicate that the public don't want this change? Does it have to be 70, 80, 90%? What would be a worthwhile number to say, okay, we can't go ahead because there's too much opposition?
What's really important to us is understanding why people make why they suggest it in different ways, which is why the free text comments are so important to us. It's, as you know, it's not a vote or a referendum, but actually we do need to listen to what people have said to us. So I think the two particular issues is making sure people understand about what parking is available. And obviously we haven't finished the consultation yet, so this was at a point in time. And also, I think particularly, and it isn't actually just about this consultation, but making sure that the public know that the NHS is open for business and it is safe to go to all of the health sites, whether that's a GP surgery or A&E or the UTC or whatever site it ends up as. But we are really keen that the public feel more confident around making sure that they use services, because we don't want people to stay away if they need care. So there's a lot of work going on at the moment about all of our sites and all of the healthcare that we commission, that the people do continue to use it and make sure that they don't stay at home worrying. So there isn't a set percentage. I think we would need to see at the end of the consultation where it lands, and also to see what else people are telling us are their concerns and whether we can address them or not. I think that's the most important thing.
Okay, thank you. Thank you, Chair.
Okay. Councillor Sanford.
Thank you, Madam Chair. Yeah, following on from Councillor Barkham's question, there was an article in the Peterborough Telegraph about this, because obviously the balance of opinion in the consultation may change over the last fortnight, but it's currently overwhelmingly that people are rejecting the proposal. So, in answer to Councillor Barkham's question, you said it's not a referendum. We'll look at what people say, but we'll try and find ways of addressing the actual issue. But can I just ask the fundamental question, really? How genuine a consultation is it if you're saying that even if 80% of people are opposed to it, you might still decide to proceed? So are you genuinely interested in what people's opinions are, or have you already decided that this proposal is going to go through and you're just tweaking around the fringes?
No, we're not, and I didn't mention 80%, but this has to go to our governing body, the outcome of the consultation, and I can assure you our governing body members are pretty tough on these issues, and if they feel that any decision has been made that really doesn't fit what the needs of the public are and doesn't address the concerns they have, they won't allow it to go through. And I'm sure Cameron would say the same about her board, about if they were not comfortable with proceeding. There are two other that goes to the NRAF board, but it also goes to our governing body. So it isn't a decision that's made by us just by looking at numbers there. So we do have to listen to what people say, and if it's something that's not going to work for the public, it isn't something that we would be doing. What I would say, I would really like to encourage councillors to encourage their constituents to respond, because we have had at that point 688, and I would like to see a larger response rate, particularly from those. If we think about, I think we've got over 45,000 visits to UTC at the moment, so there's a lot of people who use our services, and we want to hear from more people as well. So I would encourage people to promote this for the next 9 days. That'd be really helpful.
Okay, could I just come back with one further question? Is that okay? Thank you. One of the things that came up quite strongly at the previous committee when we talked about this, and it's coming up again in the verbatim consultation responses, are the transport issues. And I'm just slightly concerned that it says in the report that you're producing a green travel plan, but you don't currently have a green travel plans. So I would like to reiterate what I said at the previous meeting, that I think it's really important that this committee gets to see the green travel plan, because it doesn't just affect this proposal, it affects all of the problems at the hospital site. I appreciate you're not having them to the same extent at the moment because of COVID, but you know, some of the issues are not about car parking, it's about the sheer congestion of actually getting that number of vehicles in. So I'd really like us to see the green travel plan. But just moving on to a question, my original understanding of the basis for this proposal was to concentrate services all in one place, but we actually read in the report that it says that although you're moving the urgent care facility from Thorpe Road to the hospital, there's still going to be quite a number of services provided at the Thorpe Road site. So how does this achieve economies of scale if you're not moving things all to one place, if you're actually keeping two sites?
So can I so with the out of hours, GP out of hours would be moving, and the urgent treatment centre would be moving. That was the proposal. Is your question, what are we not moving more services there? We don't want to lose the NHS site, the site that we have at Thorpe Road, because we have community services there as well. And I know that NWA's looking at using more of it as our mental health trust. So we won't be, the aim is not to have an empty building on Thorpe Road, but to continue to use it for local services. Okay,
just one final thing then. Isn't there a danger, and I think you mentioned this in the report, that you know, if the facility in Thorpe Road continues to be open, that people will see it's open and continue to turn up there. So isn't there a danger this whole proposal will just create confusion?
Can I come in there? Possibly. I mean, the intention isn't to have urgent care or walk-in or even urgent care planned appointments there. It would be community integrated services in a planned way, so we're trying to make it that we can combine our resources for same-day urgent care, which is the big need that the public have specifically. We're trying to pool our resources to deliver that in a better way and co-locate everybody. There would still be planned care and other community services and the beds at the city care centre. And we would ultimately look at putting other things in a planned way there rather than an emergency walk-in way.
Okay, on to Susan.
This is a comment more than a question. The people that I've spoken to, when they say we want things to remain as they are, they're not taking 111 into consideration. They are looking at the walk-in centre as it was, as being exactly the same, where you just turned up and queued for 3 hours and you were seen regardless. I don't think it has got through to a lot of people who've responded that in future 111 first really is going to matter. And I'm wondering perhaps whether that should be advertised more at the moment, because even if it stays as it is at the moment, it will be very different.
So as part of the winter campaign, particularly around calling 111 first, but obviously until we have the booking facility, people won't be able to book straight in yet, but that's what we're absolutely going to be promoting.
But I don't think they've realised it yet, because I've spoken to people who have used it on a regular basis and they were horrified to think that if it did remain in Thorpe Road, they would have to change the way they use it, that they would have to ring 111 first. It just hadn't registered onto them that you can't have 3 hours worth of people queuing in a COVID situation.
That's helpful, thank you.
Susan, do you have anything else, or is that no? Okay, that's fine. Councillor Burbidge.
Thank you, Chair, and thank you for the report. Mine is regarding the car parking. As somebody whose ward backs onto the Peterborough City Hospital site, I can assure you that there is not adequate parking facilities there by any stretch at the moment. I also work as a driver that goes in and out of that site very frequently. This morning, the traffic was backed up trying to get onto that site all the way down the A47. It was absolute chaos. Some people were taking up to an hour just to get from the A47 onto that site. It can also take you 45 minutes to get from the front entrance of the hospital out to the traffic lights to come back onto Bretton Gate. A lot of, or certain streets in Bretton are being used as an overspill car park at the moment for staff that literally park up, walk over the flyover over the A47 and in the back door. And this leads to actual physical altercations in the streets where people are blocking people's driveways all day. So I really do think that the parking needs to be readdressed.
Can I just come in there? I mean, there was some significant issues this morning that we're not quite sure why they happened. The congestion out on the main road, and it was experienced by everybody. So that does happen occasionally. But the issue that you're talking about is about access to and from the site. And the issue we have is that there's only one access. So part of our travel plan, the green travel plan, about getting less people to come to the site on their own transport, it is a big part of this. But also we do want to secure a second access onto the site, which we're talking to the council and various other tenants and landlords about as well. That would change some of the congestion in the longer term. That's not going to be a short-term solution as well. But we're working on options that involve our staff staggering the start times in a different way to avoid that early morning congestion. And at the moment, we've got 20% of our staff working from home agilely and not coming to site to help out. That does help out with the overall car parking need as well. But there's more work to be done on this, and those things are all part of what we plan to do. No one single thing will resolve the situation, but all of the things will make a contribution towards the green travel plan and reducing the congestion on site. Thank you.
Thanks, Caroline. Councillor Simons.
Yeah, thank you, Chair. Although I don't want to go on about parking, I just wondered whether park and ride scheme had been considered. You could have that either end of the city. It would alleviate this parking issue.
It's definitely one of the things that we've looked at. To date, we've not been able to find a suitable location that either ourselves with the council think is adequate. And Peterborough doesn't actually have many park and rides like most cities or towns do. It's got a good ring road structure, hasn't it, and doesn't have the congestion issues that some towns have. But it's definitely something that our staff have suggested as well, a park and ride, as being something that we could consider in the future. At the moment, we've looked and there don't appear to be suitable locations close by, but it's something that's definitely on the list of options to keep considering.
Yeah, thank you for that, because I think in future, I think the parking will definitely, as Councillor Burbidge says, I think it will become an issue. So I think we need to look at all these different options. Thank you.
Councillor Rush.
Thank you, Chair. Going back a few years, right from when the Alma Road drop-in centre was closed, there's been issues with A&E department of Peterborough Hospital being oversubscribed. And for many years, this committee has asked for a front of house triage to try and get patients to go to the right place of where they should be going. This will be a single point of call for all to cover all range of services. You'll be able to book appointments to suit yourselves, so you could book an appointment to be away from when it's very busy, early in the morning when people are going to work and when people are leaving. This will reduce pressure on A&E services. Car parking, a lot of people saying about car parking issues. if ever anybody has ever been to the Thorpe Road site, 9:30 in the morning, there's only 82 parking spaces. You are queuing up there onto the access road right from that time of day. So there's not a lot of difference between queuing up at Peterborough City Hospital and also going to Park Road. Buses as number 2, 3 and 4 serve the hospital. Number 3 from the south of the river goes straight through. Although it calls up the bus station, you don't have to change buses, and the same with number 3 and number 4. At the moment, patients could go to the Thorpe Road site and then have to be sent then to the A&E. So that would put extra journeys onto their visits. I do think it's a good idea to move it all into one place. We've been asking this on this committee. Members who have been on it a long while, including like myself, have been asking for this. I know there's going to be teething troubles, but I think it's a very good idea. Thank you.
Thank you, Councillor Rush. So it looks like there aren't any other questions apart from mine. So I'm fully aware for Caroline and Jess, you're obviously hoping that majority of residents will use the 111 phone service. That's obviously not always going to happen because people need medical help in an emergency, and that's the whole point of A&E, etc. So, and I've had a look at the plan that was also sent through with the report. So it looks like it's all being accommodated. What I would say at the moment is where the triage is taking place, we are now coming into autumn and winter. And it is my hope that patients will not be standing out the front, near the front door of A&E. And I anticipate, Caroline, that this is the start of you trying to triage people going into A&E. So I fully appreciate where you're coming from, where that's concerned, but I'm more concerned at patients having to stand outside at this current time. Are there any plans to put something into place?
We're considering various options, and indeed they're stood outside the centre in Thorpe Road now anyway as well, aren't they? It's an issue because of the arrangements and social distancing as you queue to get triaged. The plan we've drawn up does give a few alternative arrangements to bring people inside, but ultimately when we're bringing people to site on a planned basis based on a 111 first appointment slot, there shouldn't be as many people queuing in an unplanned way. Would be some of the aspiration as well. But it's something that we've got to keep working on. The reconfiguration we think we've got right to accommodate the queuing theory and things, but it is definitely something that we don't want to happen in the winter, and will be an issue for patients if the queue does go out the door in the winter time, and that will be an issue at the City Care Centre now anyway, because they don't actually go into the waiting room at all there now, do they? So it's something we've got to think about with the arrangements we've all put in place for COVID and social distancing.
Okay, that's good to hear. I mean, obviously, you know, we've already been told the weather's going to start changing, so it is my concern that the patients that do feel that they have to go straight down to A&E because it is an emergency, they are going to be poorly, and the last thing they want is to stand outside. What I would reiterate, along with other councillors, is the Green Travel Plan, and I will be putting forward just an action at the end that we get visibility of that Green Travel Plan as soon as possible. Is it possible for us to see the draft that you have at the moment so that we can get sight of what's in it?
Yeah, I'll tell Paulina, but it's been on our website since our board considered it and approved it in draft some months ago. What we haven't done is proceed because of the pandemic to consult with staff over the changes and the enforcement of people not being allowed to bring their cars to site if they live close by, which is what we've proposed for some of our staff. So it is on the website. I'll point everybody to the board meeting that it was considered, and it is there, so you can get a feel for what we intend to do to ensure that less people bring their vehicles to site. And then we put more car parking in play and some electric charging points, and consider a second access and things as well.
Yeah, that's lovely. I wasn't aware it was on the website, so I'll make a point of going on and having a look at that. I think that's with regards to the UTC, if it does move through, do you consider you have enough room at the hospital to accommodate patients that would normally obviously go through to the Thorpe Road walk-in centre? Have you got enough to accommodate those, as well as what's already the patients that are turning up at A&E?
Yes, we think we have. We think we've reconfigured it adequately. We do need to remember it's not all of the patients, but some of the patients that go to the walk-in centre in town do also come to A&E afterwards as well. So it's not all additionality within that, and the out-of-hours patients as well. Some of them, if they don't get seen as promptly as they want or get the answer they want, they do turn up to A&E as well. So there is some double counting in the entirety of the attendances that we see at the moment, but it still will need the reconfiguration that we've got planned to happen over the months after the decision.
Okay, and that was going to be my next question. When do you plan on actually doing all of that work to make sure that everything's in place?
Some of the work's going to start immediately, because it's needed anyway to cope with winter and the COVID segregation that we require to be more than just temporary, and then the rest of it will proceed based on the decision that we take.
Okay. So if the Councillor Sanford, have you got another question?
Yes, just a comment really. I very much support the fact that we need to see the green travel plan. Just responding to Councillor Brian Rush's point, it is, yes, I'm not opposed in principle for having all the things on one site, but we need to make sure that site is properly accessible. And I think that the concerns I've got are about if somebody lives in Barnwell, say, and needs to come to the hospital, if they have to come to the city centre, that's one bus journey. If they have to go to the hospital site, they've got to change, and that's a further bus journey. So I think what's in the green travel plan is absolutely crucial, because I think I would hope that the hospital is urging the council to look at providing bus services that don't all go through this city centre. So, and I also think the green travel plan is not just crucial for this proposal; it's crucial for the whole future of the hospital. So, could I ask specifically that could we have the green travel plan on the agenda for the next meeting of this committee, so that we can look at what it contains and actually form an opinion on it?
Yeah, I don't see why we shouldn't. But Caroline, will it be complete by our next meeting in November?
I prefer a bit longer on that actually, but I mean we can give a position statement and we can talk you through our thinking, but I won't have started consulting with staff again about removing their access to the site and things like that during that period. That's not our intention for the remainder of this year to the end of March. But I mean, we can certainly brief the committee on what our intent is, and we won't have progressed much of that intent though with our staff, particularly before now in November. It's not been a priority, bearing in mind that the car parks are virtually empty most of the time at the moment.
Yeah, I think I would favour seeing, even if it's only a draft of the green, see it at a point, we have some influence over it, rather than waiting for the whole thing to be finalised and then it implements on them.
Yeah, we can certainly do that, Councillor Sanford. Not a problem. We'll ask Paulina to put that on as an action, which I'd already raised as certainly having a look at it, so that's fine. So can I just ask, oh, Councillor Rush, you just come on at the last minute.
Sorry, Councillor Aiken, just to interrupt, Susan Mahmood has had her hand up for quite some time now.
Sorry, Susan, I thought you didn't actually put it down from the last time, so I was thinking that you'd already spoken. Is that right?
I do apologise, I hadn't removed it. I normally stick my hand up and I'd forgotten that I had to take that one down, so apologies.
That's all right, no problem.
Just wanted to check, thank you.
Yeah, that's okay. I've been keeping an eye on it, Paulina. Councillor Rush.
Thank you, Chair. Councillor Sanford mentioned there's no buses from Palmwell. Well, looking at the timetable, number 4 bus runs from the Palmwell Centre to the Peterborough City Hospital, for your information.
Okay, I chose an incorrect example. If it was somewhere else, if it was autumn, for instance, you would have to change. Yeah, okay. Then
Yeah.
I need to do more research on the bus timetables.
That's fine. Okay, so are there any other questions? I don't have any blue hands. Okay, all right. So again, just to reiterate, Paulina, are you able to put that down as an action, that we have the green travel plan, the latest version at the next meeting in November, if that's possible?
Yes, Chairman, I've got that noted as an action.
Lovely, thank you very much. So if that isn't, if that's everything, then so the committee have been asked to note the recommendations of the report, and note the comments of the interim report on the consultation around the proposals to relocate the urgent treatment centre and GP out of hours services from the City Care Centre Thorpe Road to the Peterborough City Hospital site. Are committee members satisfied that we have done this? No objections from anybody? Okay, then we're all agreed and happy for everything to sort of progress. Thank you, Jess. Thank you, Caroline. I know this is sort of an ongoing, obviously for residents, they're very interested in exactly what's happening, and I'm sure you'll keep us up to date as and when we need to be, but thank you for presenting that report. Caroline, I don't believe you're attending the next one, so if you wish to leave the meeting, then that's entirely your choice, or we're happy for you to stay. Jesse, you're staying for the next meeting, is that right? Or the next paper? Okay, that's fine. Yeah. Okay, so on to agenda item 7.
Sorry to interrupt again, Councillor Aiken. I was just going to say about Councillor Hemraj joining the meeting. I've just noticed she's just joined the meeting.
Yeah, lovely, that's fine. So item 7, innovation and collaborative working in light of COVID-19. And so I'd like to welcome Jan Thomas, Chief Officer of the CMP CCG, and Merrick Zamborski, Head of Mental Health Commissioning for CMP CCG. Welcome to you both. Jan, are you going to be introducing the report?
Yes, I am. Good evening, everybody. Very nice to see everybody, even if it is virtually, on this nice and sunny Monday evening. What I'm going to do is I'm going to take the paper as read and just pull out a couple of bits for you through this, and then hopefully we can open it up to some questions. So COVID undoubtedly has been, just an incredibly difficult time, and it's going to continue to be an incredibly different time, I think, over the coming months. To what degree, we don't know yet, but obviously it is at the front of people's minds. But out of any really difficult times, I always take a little bit of hope that we can take that opportunity and drive some changes through health and social care. And I can honestly say that I've been a accountable officer now for over 2 years. I didn't think anyone saw that one coming on its own, by the way. But we've been, I think, what we've got in the last 6 months is a huge amount of collaboration across health and social care, a huge amount of collaboration between our hospitals, and a huge amount of collaboration in the best interest of our patients. And I think that is unprecedented. I think that is, I think that's an absolutely fantastic thing to come out of such a difficult issue that is really affecting people, their lives and their livelihoods and that of their family every single day. And I wouldn't want to underplay that. So what you can see from the paper you've got in front of you is that there's basically some key areas that we've really driven home. The first thing is that through the work we've done with social care and our community services providers, we really adapted to work out how we could do the best thing possible for our care home colleagues, in terms of not only did we deploy joint teams, but we deployed the technology, we linked that with primary care, and that was it was really helpful in driving forward how those care homes could deliver the best care possible for their residents. We also wound in aspects around medication management to make sure that they could get all the advice possible, and gave them psychological support through it. Now, it wasn't perfect all the way along, but we took some great strides in how we work across health and social care in order to get that right. And also the level of communication, therefore, we had with the care homes and had open access for them to ask questions was absolutely of great benefit to our care homes colleagues. We also introduced a lot of virtual care to our primary care colleagues. Again, we issued a large amount of technical equipment out to primary care so that they could provide as much virtual services as possible, to make sure that people could still access healthcare services. I'm sure there'll be some questions on primary care access, so I'll save those for them. But the GPs really did adapt very quickly to do a huge amount of online support. And I think the big thing for us through the first wave of COVID was making sure that we had enough coverage of our very, very vulnerable groups. The way that actually we started then having to consider together with colleagues what we did for our residents with learning disabilities, and those that are really in our mental health inpatient sessions and our settings, and I'll leave Marek talk a little bit about that more in a minute, required us to come together and work differently. I can honestly say in the last 7 months that people have stepped up. Staff across the piece have started working together in a way that I think is absolutely commendable, and we've been able to use capital that's come down to us centrally in order to enable some of that technology. We don't know what's ahead of us in the coming days, weeks and months, but we are getting more and more prepared. And what I do want to say is all of this joint working and the innovation that we've managed to do, which I'm sure you've read in the paper, is just serving to fuel us getting ready to make sure that we are really ready for the challenge, regardless of COVID, that we know winters bring, the challenges we know in making sure we can get enough flu vaccinations in place, and the challenge we've got should there be any increase in the COVID going forward. So I'm just going to hand over now to Marek for him to pick up on specifically on those mental health issues with the mental health and learning disabilities, because it really is about how we provide the wide breadth of services, and particularly for our most vulnerable groups in this time. Marek.
Thank you, John. I guess I'll start with a reflection about the time which we have gone through and still are addressing. I think I'm really proud to work for the NHS in this time. One could say, well, a background office manager, but I think amount of energy and amount of collaboration, which John described, between health and social care colleagues is just amazing, and it really gives a real strong sense of meaningful impact and support for the local population. The COVID, when it comes to mental health and learning disability services, brought about two particular streams of needs. The first one is suppressed need. So some of our services had to adjust in order to respond to the first wave of a pandemic. That meant that what we would consider business as usual was reduced. That meant the number of people coming forward to mental health and learning disability services dropped. So picking up and catching up with that gap is a challenge in its own right. And secondly, we also recognize that pandemic creates additional pressures on the local population that generates additional level of mental health needs. So conditions like depression, anxiety, post-traumatic stress disorder, and so on are becoming to be much more common compared to our normal years. John said about the paper listing examples of good innovative practice. I think I would like to pull out one or two examples which are specifically relevant for Peterborough. So the first example is what we call in the CCG mental health exemplar for Peterborough. We were able before COVID to secure a substantial investment into mental health services, which would allow us to transform our community mental health provision. The CCG decided to trial this innovation in Peterborough, and we are investing £2 million into community mental health services in Peterborough. The transformation had to stop temporarily during COVID, but I think in the summer we were able to accelerate and bring about the work we've started before COVID. And particularly engagement with the grassroots communities in Peterborough is a great example of how pandemic is encouraging us to listen to the local population and modify the responses of our services accordingly. Second example is rough sleepers. And mental health services for rough sleepers in Peterborough. My team engaged very closely with district councils and agencies operating in Peterborough and in Cambridgeshire as well, in order to support the access to mental health services for rough sleepers. So we looked at mental health training for particular agencies, and also we looked at exploring and explaining the very easy access to mental health crisis services line, which we locally call 111 option 2. There are also other examples in the document which talks about Lifeline Plus and so on. And my final point is about learning disability services. I think John was right saying that nationally we saw increase of mortality rates for people with learning disabilities up to the value of 130%. When we compare a number of deaths of people with learning disabilities locally with the same period last year, we do not have any significant increase in the number of reported deaths. This is a really great testament to collaborative work between health and social care colleagues, providing really comprehensive level of support in order to mitigate against potential increased mortality of this vulnerable group. So in summary, I think really good examples of great practice, of great collaboration. And I think I'm really proud on behalf of my team and on behalf of the CCG and social care colleagues to be working in this area, despite all the difficulties COVID throws at us. Back to you, John.
Yes, so as we can see, what we're trying to do here is really capture some of the innovation that's happened. But I do want to say, for those things that we had to do differently, that it's not appropriate to carry on doing it differently, we are trying to moderate that back as well. We have now spent 6 to 8 weeks really trying to define a recovery plan to make sure that we can get the activity back up close to where it was last year, despite the infection prevention and control guidance that we have. So it is a question of moderating things to the way and where care should be provided, and not just taking advantage of the fact that because we've changed things, we don't have to change it back. That isn't the position we've got. I do just want to end to say, there is a lot of coverage at the moment around what's going to be ahead of us in the coming days, weeks and months, which we don't know about. But, we have staff across health and care continually giving their all every single day to serve the population of Peterborough. And I just, in every opportunity, I just want to make sure that we just keep thanking all of those staff, because it is going to be a long winter ahead, and we just all need to just keep making sure that they've got enough, I think the technical term is oomph, to get through it, because you know, it is going to be really tough. And I think we all need to listen to what our staff are telling us to make sure that we can get through this, and that is staff across health, social care, and I can't say enough about how brilliant areas like the voluntary sector have been supporting us through this. It's been unprecedented, and we're incredibly grateful.
Thank you, Jan. First question from Councillor Sanford.
Thank you, Madam Chairman. Yeah, I think it's really encouraging to actually see this report and all the different innovative ways that, you know, health and social care are working much more closely. I just wanted to focus particularly on section 4.3.4, which is the recovery plan for primary care. And point number 4 is maintain the use of electronic prescribing at all practices. So yes, that's really good that, you know, people can get their prescriptions electronically, but I think that the problem is the majority of people still have to go to a pharmacy to pick up their prescription. And I think you don't need to be a clairvoyant, I think, to see that the COVID situation is deteriorating, and we could end up, you know, going into much more restrictions. So has the CCG looked at the possibility of reducing the frequency with which people have to get repeat prescriptions? Because, you know, if you can, it just seems to me that if you, in these COVID emergency times, if you could reduce the number of times people have to go to their pharmacy for sort of routine repeat prescriptions, you know, that would take some load off the pharmacy, but it would also reduce the number of contacts that people are having.
Yeah, I'm going to ask Jess, I hope you don't mind answering that one, because you lead both primary care and medicines management.
Thank you, Jan. So at the beginning of the COVID crisis, we did relax some of those rules about the 1 month prescription. It has gone back to normal. I think it is something we're going to look at again. The reasons why we do that are multiple. It's not just about money, it's about people stockpiling medicines that they're not using, and then perhaps then taking too many. But I will take that back to the team and say, as we seem to be looking at more pressures again, and potentially looking again at people needing to stay home, then I will have a chat with the medicines management team about that.
So can I just add another comment in there? Is obviously we're taking a great deal of care to look at the lessons from wave 1 to get ready in case there is a second wave. So actually Jess and the team in primary care are going to review everything that we did in wave 1 to see what we need to reinstate if it happens, if we end up in a crescendo later on. I'm sure Liz is much better placed than any of us to give comments and feedback on that. So anything like that are ideas, if people found them valuable, just let us know. But do be assured that not only in our recovery plan about how we make sure that we get everything going again, we're also looking at the stuff that really work to make it easier for patients should we end up in a second wave.
Thank you. Councillor Emma.
I've got a couple of questions, if that's all right, for Jan and for Marek. So one, we know that as soon as the winter months hit, from about now, we've not just got COVID to deal with, but we've got flu and neurovirus. And to be able to keep the staff in work in care homes and agencies, will the CCG be looking at weekly, fortnightly testing for the staff to actually keep going into work? As well as you talk about the care homes, does this include homes where disabled and vulnerable residents live, not just elderly residents? And also I do know that patients discharged from the hospital into care homes have their COVID test before they can be discharged, depending on the pressures of the beds at the hospitals, that will still be carrying on, because what we don't want is a risk of patients being discharged into homes that are COVID positive, which has happened up and down the country at the start of the pandemic. The other thing is, sorry for the number of questions, is that in a week or so ago, Matt Hancock had mentioned about agency staff working in a number of different areas in care homes and in resident homes and in nursing homes. How is the CCG going to stop these care workers going from different work area, because potentially they could be a super spreader but not having any symptoms? So will we be looking at care agencies to actually test those staff so they're not spreading it around in all areas? Do you want me to go on to the mental health questions, or do you want them bits first?
Go on, keep going, and then I'll try and answer them all at once.
And the other one was for you, Jan. Jan, it was for the recovery plan. We all know that the COVID rates are increasing, and potentially we could be going into a national, local lockdowns. We don't know. The recovery plan is great, but will that come to a halt if we're all dealing with high incidence of COVID patients to like we was at the start of the pandemic? And do you want me to go on to the mental health ones or Marek?
Shall I do those first, and then we'll
fine.
go on to
Thank
mental
you.
health ones? So okay, so I'm gonna I've written them all down, so I'm gonna say a few things, and then let me know if it didn't captivate some of the answers. So firstly, the commissioning of care homes is actually responsible of the local authority. So actually the infection prevention and control work that the local authority have done, supported by the CCG, which we've highlighted in the paper, has been very important. And I think, Liz, I'm correct in saying that we have had notification in the last couple of days that the infection prevention and control monies that was given to local authorities to make sure that they could actually pay staff if they had a positive COVID test was going to continue. However, it is at a reduced, the total pot that's been given to local authorities is at a reduced rate. And that's a really important point in this agency staffing point that you make, because the issue is that agency staff tend to need to work to earn, and therefore if they are positive or they do have symptoms, it's very important that they can feel safe in not working and then not going from home to home. So that's a really important point in that agency staffing point for infection prevention and control that we are dealing with. Liz, I think that's the right summary there, isn't it, about that agency?
Certainly there is some funding that's been announced. It's slightly different from the previous funding, but yeah, the basics you've expressed are absolutely right.
So so then if I go on to, so if you've got staff, agency staff that we're trying to look after to reduce the movement around, you've then got to make sure that the testing flows to where you need it to flow. And I have to say, I think that I don't think I'm going to say anything controversial here, which is there has been some issues with testing. I think the lab capacity for testing is the issue, and I think that's really important for people to understand, because it's not just about are we booking people into slots, it's can we process the results. And actually those results come, the lab testing has to be used for the whole of the country. So it's not just can we use our labs for our patients, where there are spikes elsewhere, we need to make sure that people have access to those labs. So testing has been very tricky, but we have taken some big steps in collaboration with the local authority, and Liz, again, you might want to come in on this, to make sure that we have met representation from NHS England and the Department of Health to make sure that we are doing everything that we can and trying to get the testing increased. We are continuing to push for more Pillar 2 testing, and we're also investigating how we can get additional lab capacity in outside of the national lab capacity. I don't think that that situation is going to miraculously resolve itself in the next week. I think nationally, and we agree, that's going to take 2 to 3 weeks for the testing to really settle down. Liz, is there anything else that you think would be helpful there?
I think the only thing I'd want to add is that people are sometimes a bit confused, and if they've been in contact with someone with COVID and they don't have any symptoms, sometimes they go and get a test just to check, or they get a test before they're going on holiday or something like that when they don't have symptoms. And at the moment, because there is this limitation
on the lab capacity. It's really important that it's people with symptoms who go and get tested, because that will make a difference to them. That will decide whether they go to work and isolate or not. If you're a contact of a known case of COVID, even if you go for a test, it doesn't make any difference. You've still got to isolate. So I think that it's just getting that message across. Don't go for a test unless it's actually going to make a difference to what you have to do.
And then the third point that you made in the first bunch of questions, and I will come on to the recovery plan, is actually about the all types of care and all types of care home. We do recognise that, as we said before, we've got some very, very vulnerable patients out there. I mean, if I take an example like the St Edmund's Trust, who we did a call with last week, who were real strong advocates for their LD patients, and we managed to arrange some additional testing for them a few weeks ago. Because of the testing restrictions, we haven't been able to maintain it. So we've had to work very closely with organisations like that and other organisations to make sure that there's everything that can be done. So it's not just the standard nursing homes as such. We're going far and wide. And as Marek said earlier on, it is testament, I think, actually to some of those care homes and the care that they're providing and the infection prevention and control that they're using that's left us with some of the outcomes for those particularly vulnerable patients. That is very important. And you're absolutely right. We have spent now weeks working on the recovery plan with the very clear letter from our regulators in NHS England and Improvement to get care up to where it was last year across a range of areas. I think it's fair to say the assumptions we were asked to make in that planning were that there was a very, very little COVID. I think we are very realistic about the fact that, you know, with what's going on nationally, we have to be prepared. I think what we need to do is be very, very careful in that we need to really balance off the measure of harm between what we stop and what we have, and we have to balance it off with the prevalence of COVID. So it's a question of that risk assessment, and we're really working closely with our clinicians to say it won't be a case of let's just switch everything off. It will be a case of what have we learned, what can we do differently, and how do we really take those rules to try and make sure that we can continue to minimise harm. Previously, we really did maintain our cancer services, and we really did push a lot of care very differently. And we would want to really continue to do that if a second wave did come. So it's quite a balancing act, but I think everyone's really committed to make sure that we have as little disruption and keep that public message going, which is if you've got symptoms and you are worried, you really must seek help, because we don't want this built up, pent up demand of people having hung on through the first wave and now through the second wave to potentially get help. It's really important if they're worried that they go and see their GP. Does that answer that first group of questions?
Yes, thank you, Jan.
Excellent, thanks. And then you had a mental health question.
Yeah, so with the CCG, pre-COVID, CCG was obviously looking at £33 million worth of cuts. Okay, and with furlough coming to an end in October, and people's stresses and anxiety is at a high, whether they're at risk of getting made redundant or they're still on furlough, or, you know, COVID and winter coming and financial issues. What mental health provision has been provided? I see that you've been given extra funding of £50,000 to expand the crisis team for only another 3 to 6 months. Now, when does that 3 to 6 months end? And what's going to happen after that 3 to 6 months? Because this is not going to be a short fix thing. This is going to be long-term thing that potentially can leave some of our residents in Peterborough with serious mental health that's going to be needed months and years of treatment.
Marek, did you want to start off on some of that, and then I can chip in?
Okay, that's fine. So I think very pertinent questions. I was wondering that we've gone so far in our conversation and we haven't mentioned money yet. So here it comes, the money first time. So I think that I'll start with the positive news. The positive news is that we have a mental health investment standard in the country. And the definition of the mental health investment standard is that the mental health investment is protected regardless of the financial situation of each CCG. So I think there is a clear requirement how much money our CCG has to put into mental health services year on year. So the paper quotes £50,000. This is just an example of a small scheme which made a big impact. But this financial year, our CCG put £6 million worth of real mental health investment increase. So this £6 million is distributed across a variety of mental health services. So this is, for example, prescribing of medications for those that need medications, additional money for CPFT services across all required service lines, additional money for voluntary sector services, and so on. The whole breakdown of that investment is available. £50,000 is an example of the additional money which we put into our mental health services system, well above £6 million. And this is a COVID generated needs. And I think this is that there is a fundamental question that some of the £6 million which we invested in this financial year only goes that far towards meeting mental health need. And that would consider that to be our usual year. What COVID is doing to the mental health needs of the local population, it's, for example, doubling amount of the depression and anxiety in the local population. And I think there is something which we as a country and locally will have to seriously look into because our even £6 million only can go that far towards meeting some of the needs as you described. So in summary, yes, there is our CCG is putting into mental health services as much as we can and we should. What happens above the mental health need in the population is, I think, is the subject to our local and then most importantly national settlement, and we haven't had the guidance about that so far. John, would you like to add anything?
Yeah, so I mean, fundamentally, we had some news back end of last week, which we're just analysing about the different financial arrangements in place for the NHS for the rest of this financial year. But also we have to be very mindful that we can't keep increasing costs because as of 21-22 financial year, as of April, we need to be mindful that we haven't put in a load of additional costs that then we can't afford. So again, I come back to our real clear analysis and risk assessments for what we're putting in place, because we are really trying to do everything we can to deal with this, but we can't keep building in huge amount of additional costs that we know the funding won't be there for next financial year. So we have to be respectful of that.
I just ask a supplementary question. So we've got you've put on extra mental health support for residents. Do you actually have the extra staff to actually deal with meet with these patients? Because obviously you're getting £6 million to do this, but we need people to actually provide the services, and if you haven't got the people to provide the services, then obviously our residents are still going to suffer.
So I'll start, and then I know Marek will jump in. So I think I've said a number of these meetings that if somebody said to me, here's a big wad of money or here's a big wad of staff, I know which one I would take, and it's always the big wad of staff, quite frankly, because the workforce are really valuable. And what we're finding throughout what we're trying to do at the moment is A, there's a lot of work going on to make sure staff feel supported through this, but B, to make sure we're making maximum use of the staff that we have got. And you're right to spot that we haven't had a massive influx of new staff into health overall to do this, but we are out looking for different ways to do that. So Marek, specifically on that mental health ask.
Yeah, so we have reasonably sensible recruitment plan to be able to deliver staffing levels throughout the year which I would call business as usual. If you start looking at additional need generated by COVID, this is going to be a fundamental risk to, even if, as Jan said, someone gave us miraculous amount of money to be able to find the staff required to be meeting the level of need which COVID generates. However, having said that, there are examples of innovative practice which we could look at depending on how the settlement about mental health services will go forward nationally. So example of that innovative practice is we have huge number of already trained psychological therapists out there in the community. They are registered with appropriate bodies, relevant professional bodies. We are not tapping into that support fully yet because we are able to contain our normal years within the existing portfolios. If we were to, and if this became a national priority, these would be type of conversations we should start having. But you are right, identifying a number of staff be able to be supporting the level of mental health need in the population is a significant risk, and we would not be able to mitigate fully against that. That's a fair comment.
Yeah, that's it from me. Thank you.
Okay, is that everything, Councillor Hemraj?
It is.
Okay, Councillor Sanford?
Yeah, I just wanted to come back to a point that we've discussed in the past, and I noticed it's on our ongoing issues report coming up later on. This idea, this thing about GPs requiring patients to ring up at 8 o'clock in the morning if they want an appointment. Now, this report's all about how GPs and other people have become more innovative and collaborative, but the GP practice that I go to has actually withdrawn people's ability to make electronic appointments. So, you know, is that happening at other practices, and are GPs possibly using the COVID crisis as an excuse to introduce even more of these restrictive practices?
Jess, did you want to take that and then I'll chip in at the end?
Yeah, so we have, so initially in April, we did see numbers of appointments dropping off, more because people were not trying to get appointments, they were not leaving home or seeking help. We've done a lot of work to try and encourage patients back to GPs because that's where everybody should go. What nationally is being operated is a telephone triage first. So everybody rings first in order to have a triage with a clinician before there's an appointment made. That does mean that makes it more difficult for electronic bookings. Some are still doing that, but in much more limited numbers. Because what we were seeing is that we back up to the level of appointments that we had pre-COVID now, but a lot more of those are either by video or by telephone, which maintains the safety both for patients but also for staff within the practice. And we want to encourage people to do that as much as possible. However, I want to be really clear that if you do need to be seen and it's clinically necessary that you need to be seen, you will be seen. And that will be a clinical decision that you make with your clinician at the time. So all the triage systems have changed across the country. So that's probably why you'll find that particular issue. Again, it's one of those recovery things that we want to keep. We want to go back to that at the same time as making sure we take the best of the virtual consultations, because actually some people have found them much easier to access. Some people don't like it. They do want to see face to face. That's a conversation they have to have with their clinician, and people will be seen if they have to be seen. I want to make that really clear. We don't want people to stay away from general practice. We have had some issues with telephony. So if you imagine that you've got a practice that has X number of telephone lines, because so much is now going through the phone lines, not just coming in, but also going out, we are going to be looking at putting some more investment into telephony so that you don't get that blockage where you can't get through, particularly first thing in the morning. So we are working with some practices on that too, and more digital solutions, and we put in a bid into NHS England this week as well on improving that. But as always, if you want to come to me directly, if you've got a particular issue with your own practice, then I'm happy to pick that up.
Is that everything, Councillor Sanford?
Yeah, I can take up the individual case with Jessica as she says, but it just seems to me that you to have an efficient triage system, you don't want people calling all at the same time. It just seems a rather crazy way of operating, really.
Okay, are there any other questions? No.
Sorry, just from myself, going back on the GPs from Councillor Sanford, has it come to your attention where we've got all these big GP surgeries and then they've got little pockets of surgeries dotted all over the place, like the Octagon and the Nightingale practice with all their different surgeries? Now, I've noticed, like the Nightingale surgery, they've actually closed the surgery in Palmwell and directing their patients to the Nightingale in Dogsford. Now, is that happening quite a lot around Peterborough, where GP or surgeries are telling to go, their patients being told to go to their main hub? Because that actually concerns me, where residents live locally, cannot get to their local GP and having to go miles away to their biggest GP surgery.
So there are a couple of examples. I think there's 2 in Peterborough and 2 in Cambridgeshire as well. And that's where they haven't, because they've had to shield some staff, they haven't had enough staff to have at each practice, each branch site. And also because what we've got to do in each site is have a hot and cold entrance and exit. So if you've got a small building, that becomes very difficult, and particularly if you then have to sometimes staff it with more people to make sure people are going the right way in and out of the building, and it's a hand sanitizer and everything else at the front of the building. So there are a few places in Cambridge and Peterborough that have taken a decision, because of staffing levels and because of the configuration of the building, that for the COVID period, it wasn't safe to keep that open for the time being. That's not a permanent situation. We're not planning to close branches, but that is a response to the COVID situation, and we will be discussing it with the practice. Fingers crossed things start to improve soon.
I just come back on that one. You said they're not planning to, obviously it's a short-term thing during COVID, but what happens eventually if it does work and then the CCG does start looking, actually this is working really well, we want to start closing these little bits of
we're not planning to do that, and any GP practice would have to apply to close its branch site, and we haven't approved any closures at all anywhere.
I think that's really important, because I think it comes back to the point that we have to change stuff sometimes to manage what we're having to manage. But there's a number of examples where we do understand the process if we want to change things longer term, and we in instances like the minor injuries unit where we do want to do something different going forward, we're still following the processes that we have to follow. We're very respectful of what we need to do on that. And that's very critical for us.
Okay, so that looks like that's all the questions that the committee members have. So we have been asked, it is recommended that the Police Health Scrutiny Committee discuss the innovations and collaborative work that has been developed during the COVID-19 pandemic and note the recovery plan work already undertaken to date. So if all the committee members are happy, we will note the contents of the report. If there are no objections, I'd like to say thank you, Jess, thank you, Merrick, thank you, Jan, for attending and presenting your report. It's very welcomed. I found the report extremely useful to sort of update us on everything that's happening. And just to reiterate, Jan, yeah, I think, you know, all of not only the NHS workers, the volunteers, the council staff, everybody that has basically just gone above and beyond during this pandemic, they've just been brilliant. And I think even residents are sort of feeling the love and are really appreciative of everything that's being done. So thank you very much. So that's the end of the report. if you wish to leave our meeting, then by all means do so, and have a little bit of time this evening to yourselves. So thank you very much for attending. Okay, so we are now on to agenda item 8, managing COVID-19 public health update. So I'd like to welcome Dr. Liz Robin to present the report. Liz, over to you.
Thank you, Councillor Aitken. And I will take the report as read and just go through the highlights and then ask for questions.
That's fine.
So at the moment, when we are managing the response to COVID-19 in Peterborough, we're doing that within our local framework, which is our local outbreak plan, which is on our council website. And we're doing it within the national contain framework. The National Contain Framework is important to us. It was published on July 17th, and it does give us some additional powers as a local authority. And it also places local authorities potentially on the national watch list if local authorities have higher numbers of cases. And really, since the Contain Framework came out, Peterborough has had numbers of cases which are above the national average, and it's been on the national watch list, but in the lowest category, which is an area of concern. That means that central government is aware that we have a higher number of cases, but it believes that we can lead locally on the response. We haven't moved up into the higher categories of enhanced support or intervention, where the government intervenes directly to support us. And I would like to thank our local communities and staff for that, because everybody's worked together. And I think that we have seen our communities and our community leaders really working together just to encourage people into COVID safe behaviours. We're not perfect, nowhere's perfect, but it has made a difference. And there's been a really good community response in Peterborough. So we are still an area of concern, and just talking about what's happened recently, and probably after this paper was written, because it was written quite a while ago, on our sort of numbers of COVID cases. We were getting quite worried about the numbers around the beginning of September. The numbers were rising just as they've been rising nationally, and went up again to over 30 per 100,000, which is around where they were in mid-July. So we were on a rising pattern and concerned about it. And that pattern was increasingly around the more central areas of Peterborough. So there was a clearer geographical distribution, with some of the sort of central areas of Peterborough having the highest rates. And that was quite a clear pattern. And we were aware of that transmission between households is quite important. So that was a bit of a feature that was coming out, as well as things like people travelling to work, car sharing, things like that. So a few reasons why we were seeing spread. What's happened since the problems with the testing, which started around September the 11th, is we've seen our numbers of diagnosed COVID-19 cases go down. And that we think maybe because there was an announcement that walk-in cases were gonna stop. Everyone had to book a test, and we think that sort of means that some people are finding it harder to get a test. So our COVID-19 figures at the moment are down. They're under 20, about 17 is the latest figure, but we're a bit worried that reflects some people finding it very difficult to get a test through the internet systems, when previously they would just have been able to walk in central Peterborough. So we are concerned. Today, we had the Chief Medical Officer and the Chief Scientific Officer describing the national picture with a very clear increase that we've seen nationally in people aged 18 to 30. We've seen a bit of that in Peterborough, but it's been a more varied pattern. But nationally, we've got that very clear increase in cases, and other age groups nationally are starting to go up as well. And the national increase in cases is doubling about every 7 days. So many of you will have seen this, and clearly it is of concern to our Chief Medical Officer and our politicians, and that we're expecting further national announcements tomorrow. So we absolutely need to continue what we're doing in Peterborough, and we need to be mindful of those national announcements. The Chief Medical Officer and Chief Scientific Officer made it very clear that there was certain interventions that we could do for COVID which are relevant to Peterborough. So I'll just talk about that a little bit, even though it's not quite in the paper. The different interventions were firstly things that each individual does, like washing their hands, wearing a face covering in crowded spaces, and keeping 2 meters distance from other people whenever they can. So that's sort of individual. The next thing is going for a test and self-isolating if you have symptoms, and self-isolating if you're being in close contact with someone with symptoms. So that's the next bit, the sort of test and trace bit. That helps to stop the spread of coronavirus. The third bit is a bit more about social mixing. So it's about different households seeing each other, going to each other's houses, or social contact at work. And that is something where, given the current situation, I would recommend to households in Peterborough to try and minimise the amount which they mix, because COVID-19 rates are going up, and we do have some evidence locally that households going into other households and mixing is one of the things that can be causing community spread locally. We've got a little bit of local evidence, so that's a message I would like to give. And the fourth thing is the new treatments, the vaccine and so on. And clearly the message on that is that we may have a vaccine early next year, but at the moment we don't. The treatments have improved, but COVID is still very dangerous. So we still need to really do those social interventions and community interventions to try and prevent it. So one thing I'd just like to flag as well, I think we have had some really good practice in Peterborough, including the work of our community leaders, but also including the work of our environmental health officers. We're running a pilot for local enhanced contact tracing, where cases that can't be contacted by national test and trace are contacted locally by our environmental health officers. And they're doing a fantastic job. They're getting a 90% success rate nearly for cases who the national team couldn't contact. And our rates of being able to contact cases of COVID-19 and interview them are currently the best in the region. And that's down to that work of our local environmental health officers who really know the community. So I did just want to give them a bit of praise. I'll stop there because I've talked for quite some length. Just a few things I wanted to get across. I'm happy to take questions.
No, that's fine. Thank you for that. Councillor Sanford first.
Thank you very much for a really interesting presentation. I think I'd like to start by saying thank you to yourself and to all members of your team for the hard work you've been putting in to try and contain the sort of outbreaks in the Peterborough area. One of the things that you introduced when it looked a few months ago that the rates of infection in Peterborough were increasing were these places in Peterborough where people could walk in and have a test if they got symptoms. Now, I actually appreciate that you've been told from on high that you sort of had to close them, but I do think we've seen the article recently in the Peterborough Telegraph, which was telling all sorts of horror stories of people ringing up the helpline, and I think one gentleman was told he got to go to somewhere up in Scotland, and other people have been told to go to Leicester and Birmingham. And we do have a population in Peterborough where quite a high proportion, somewhere in the region of 25 to 30% of people don't have access to a private car. So have you made any representations to the Department for Health to say that, having these local testing sites where people can turn up and have a test is in my view absolutely crucial, because if you make it really hard for people to get a test, the chances are a lot of people won't have one, and that's a recipe for sort of losing control. So could you comment on that perhaps?
Yes, that's a very good question, Councillor Sandford. And I would say that the mobile testing units are still coming to central Peterborough. It's just that people have to book a test over the internet or by phone and can't just turn up and walk in, which was the case before. And I think that for some of our residents, that does make it much more difficult, because as we know, there's a lot of demand for testing, and you may have to be quite persistent in order to try and get your internet or your phone booking. So I think that that is an issue. I know that that's being worked on nationally, and because the problem is the capacity of the labs, as Jan said. And so work is going on nationally to expand that lab capacity, but that will take a little time. So I absolutely agree with what you say. And we are making representations locally to get something called a local testing centre, which would be in Peterborough, not as a mobile testing unit, but 7 days a week in the same place, and very much for local people. And we'd hope that we'd have more flexibility with that, because the mobile testing centres are very much run nationally, and we're trying really hard to try to get a local flexible solution that ensures that those people with symptoms who really need a test but find it challenging to access through the national routes are able to get their test locally. So we are, yeah, absolutely, we are making representations on that to the region, and trying to get a local testing centre.
Okay, on to Councillor Ali.
Thank you very much, Chair. First of all, I think we need to compliment the good work that many of our communities have done. I particularly want to highlight the work that our local mosques have done, and the worshippers in the local mosque in cooperating with the management. And I'm grateful to Liz for the presentation that she has made in quite detail. The concern really is accessing testing. That's the first one, particularly for many of the people that I represent in North Ward, in the Millfield area of the city. And Liz has acknowledged the fact that many people don't have access to the internet. Language is an issue as well, although we've had translated material, videos posted, etc., which have been extremely beneficial, and that's been a very good positive step. But still, I fear that a lot of people will miss out because they just haven't got the capacity or capability to go through the telephoning or online, basically, to book a test. So let's acknowledge that. So I'm grateful for that. I hope that something will happen as a result of that. The other issue, and while I've been actually in a meeting, a message has come through that the large gatherings, as I already acknowledged, that many people, in the mosque, the congregations, fantastic response, people are cooperating, but there have been large gatherings in the Millfield area. While I've been speaking, basically, I've had a message come through, large gathering on the corner of Windmill Street. It's always there, people drinking alcohol, large groups of people, and people ring up the police, etc. So it's really, we really need to up our game in terms of really enforcing, because otherwise, we're all going to be at risk, and that is very important. So I think that is a big issue for me in my ward, because I'm getting a relentless number of messages just about every day. And in fact, last Wednesday, I had a walk around with some senior officers as well in the area, and we witnessed what was happening as well. So I would really ask and urge Liz to work with our partner organizations and find a way where, you know, we can actually try and get these people to disperse. And what's not helped, the availability of cheap alcohol in the Millfield area. People buy cheap alcohol and drink on the street in large groups or in the children's play areas. And that's becoming a big concern. And I'll leave that there, basically. I just feel that it's important to highlight that we need to get to grips with this. It's becoming quite a major issue.
Thank you, Councillor. And I absolutely would echo what you said about our mosques and the very, very good work that they've done in terms of ensuring the social distancing and ensuring good processes and getting messages across as well. I think they've been fantastic partners, and I absolutely take on board your comments about the need to address large gatherings outside, and also particularly inside if we become aware of premises where people are gathering inside, because that's even more dangerous than outside where there's less ventilation and so on. So we do have powers under the contained framework, and we will absolutely be wanting to engage with communities, to explain, to encourage, but we are very much aware that in some cases we will need to enforce with directions, and I will do as you suggest and ensure we have those discussions with partners such as the police and others, and make sure that we're taking the right proportionate approach. Thank you.
Okay, Councillor Hemraj next.
Yeah, thank you for your report, Liz, and all the work that the council has been doing. Two things going on the back of Councillor Ali's large gathering. As you're aware, in August time, there was a large gathering, a rave at the Chestnut Centre in East Ward. I understand that potentially there was another one going to happen at the East Community Centre. So it's about trying to stop these large gatherings, and also what work is, we're getting an increase of homeless people now on the streets, and yes, the council have been putting them up on the in hotels, but I'm getting raised to me that there's homeless people now camping out in various parts of my wards, which council does know about. Are we reaching out for those? Because obviously they're high risk of COVID. And the other thing is, Peterborough being on the watch list, and we've been on the watch list for many weeks, and potentially there could be national lockdown, local lockdowns. When is the point going to be when yourself actually put in the powers that we've been given as a local authority to actually go down a local lockdown, or to start closing restaurants earlier, CAS and that, to actually stop the rise of these COVID infections? Thank you.
Okay, those are good questions. I think the large raves and so on are really a matter for our police colleagues, and we will be having those active discussions about the best way to approach it and the proportionate way to approach it. In terms of the COVID risk for homeless people, I know that there is a lot of thought going into this, including at the CCG, which Jan mentioned, but also we have what we call a vulnerable people subgroup of our outbreak management teams. So we do have plans in place, and also try and do preventive work for people who are rough sleeping or homelessness if they do develop COVID, and that is so Public Health are working closely with housing services across Peterborough and Cambridgeshire actually to just make sure we've got those links and we can act quickly if we become aware of an outbreak or a case. So there is work going on in those areas. I can give you some assurance on that. In terms of the use of our powers, yes, that is something that we are certainly prepared to do if necessary. The approach that we take is we always try to engage with a community or with a business first. Our main experience so far has been around events. And working with people planning events on their risk assessments. So there's quite a lot that goes on behind the scenes for a number of events, and also from our environmental health officers with businesses and hospitality businesses to just do preventive work, look at their risk assessments, make sure that they are complying with COVID safe guidelines. So a lot of that goes on. And sometimes if an event can't comply with COVID safe guidelines, the organisers themselves say, well, we'd rather not do it, once they've had that discussion and we've had a really good interaction on it and everyone understands each other. So we haven't really used our local authority powers yet, but I'm very aware that as cases increase and if there are elements of our communities who are not observing the guidelines, who are gathering in large groups inside, in particular, restaurants or pubs, and it's quite clear that there is a high risk there, then we will do our persuasion, we'll do our engagement, but we are then able to issue directions. And often what we would do is not just say, issue a direction to close, which is within our powers, but go to a halfway stage where we say, we'll issue with this direction, and if you don't follow the direction, and act in a COVID safe way, then we may have to bring in the full power and close you down. So I've been talking to other local authority areas which are taking that approach, and it does seem to sometimes be needed and to be quite effective. So yeah, absolutely, we are ready to use the powers and we're ready to issue directions so that there is in a sense a warning given to premises that are really not complying.
It looks like, oh, Councillor Simons in there at the last minute.
Yeah, just very quick. Just like to thank, echo everybody else's thanks to Liz and the team, the work she's doing, and thank mainly the whole of Peterborough, you know, for the consideration they're doing about this COVID and behaving themselves. And obviously, we need to obviously just clamp down on the few that are not behaving. I appreciate what Liz is doing. Thank you.
Thank you.
Thanks, Councillor Simons. So just one question from me, Liz, with regards to funding. In your report, you mentioned over £1 million in funding. Can you just explain what that funding is for? How long you think it's likely to last for? Are you likely to need any more if we go into a second wave?
Yes, Peterborough has received just over £1 million, £1 million and 17,000 under what's called the Test and Trace grant. And that comes down from central government specifically to implement our local outbreak control plan. So we're using it to support increased staffing resource for environmental health and other services that can support environmental health. We've strengthened the public health team because we're now running an 8 till 8 outbreak management centre 7 days a week. So that's required some increased staffing. And we've taken out contracts in order to be able to buy more tests for outbreaks. So we've got some specific contracts there. And we've put money into our communications function so that we can have really good comms with the community, and that's absolutely essential. So there's a range of ways in which we are spending the grant, and we have a subcommittee of our Health Protection Board which looks at business cases and agrees the spend. So at the moment, we are working within the grant and doing fine. You're absolutely right that if there's a surge and we need yet more people, potentially more tests if we can buy them, and a generally higher level of expenditure, then we will need to keep a very careful eye on that funding and go to central government as soon as we see that there's a risk that it might be exhausted. I think we are getting good value because we are working across Peterborough and Cambridgeshire. So a lot of the contracts and the teams that we are supporting are working across the area, and that gives better value for money. So the money should stretch further because there are economies of scale. But yeah, it's one to keep a close eye on as things potentially get more challenging and more resources needed to put into it.
Okay, well, obviously, you know, anything that our committee can do to help you in obtaining more funding in the future, then just let us know, and we'll do whatever we can. What going slightly away, one other question, obviously, we are aware that the Public Health England is being changed slightly through Matt Hancock MP. Can you just give us an update on whether that's affecting you and your team? Because obviously going through a pandemic, I sort of look at it as it would be good to keep everything the same rather than actually changing things, because you all know what's needed now. So I'm a little concerned that, you know, there might be things that start to change mid-pandemic. Can you just sort of elaborate on what's happening, please?
Yeah, no, definitely. So the announcement that was made was that there would be a new Institute of Health Protection formed with a strong focus on pandemics, and part of Public Health England will go into that, but so will Test and Trace Service and a joint biosecurity centre. And clearly my chief concern, in a sense, as Director of Public Health, my immediate concern is that we work with some very good staff in the regional Public Health England health protection team, specialists in infectious disease, who are in touch with every day and help us with our local response and provide advice directly to our care homes and schools. So I really wouldn't want to see those staff destabilised by this process. So my understanding is that although right at the top it's coming together now, for the staff, they are really not looking to implement until next spring, so that there should be stability for those staff that we work with. And to be honest, they're talking about the other functions of Public Health England, like health improvement and health intelligence and so on, sort of going other routes and separating out from the infectious disease function. But all of those staff at the moment, I think, or nearly all of them, are being drawn into the pandemic response anyway. So there's a sort of now situation where the staff are working very hard on COVID, and we're working with them. And the indications are that actually the government plan is to maintain the stability of that through to next spring. And that's the point at which the change will happen for those frontline staff, rather than the sort of the head honchos at national level.
Yeah, well, I guess when we get to that stage, it might well be that our committee has an update report, just so that we know sort of how it's affecting you and your team. And obviously nearer the time we'll know how we're coping with COVID, etc. So Councillor Sanford, I noticed you put your hand up. Happy to have you ask a question, but I'm just conscious of time. So
yeah, just very briefly, I just wanted to endorse entirely what you say about, you know, it's completely crazy changing the structures at a time of national crisis. I think it's even more disturbing that the person who's currently in charge of the test and trace system has been put in charge of the new agency, which is a rather baffling decision, I think.
Yeah, well, let's just hope. I mean, obviously, Liz has said that things hopefully won't change until next year. It's just more higher up that it has, but I'll keep a watching brief on that, I think. So Liz, thank you very much for that. We have been asked to note your report on managing COVID-19 public health update. Thank you for bringing the report and presenting it. And again, as others have already said, thank you for everything that you're doing. We really do appreciate it, and pass our thanks on to your team as well. and let them know that we're always thinking of them. We know they're extremely busy, and the people of Peterborough really appreciate what they're doing. So thank you very much.
Thank you. I'll let you know. Thank you.
Lovely, thank you. Okay, so time to crack on. Item 9, which is a review of the 2019-2020 work programme. And I believe this is over to you, Paulina.
Yes, thank you, Chairman. So this report comes to the committee annually at the beginning of the municipal year. There are 3 items to consider. One is to look in review of items that have been presented to the committee over the past year and to decide if you wish to continue to monitor any of those items going forward. I also attach a draft work programme for this municipal year, which is work in progress. It is a draft work programme, so it's for you to decide if you wish to add anything to it at this point in time, or add items to it along the year. We've already had one item mentioned this evening, which is the hospital green travel plan, so that can be added to the next meeting. We do have the group representatives meetings, which obviously the agenda for the following meeting will be discussed. So it's not set in stone, the work programme, but it's a general idea of what you wish to look at over the year. There's also Appendix 2, any recommendations that were made over the last year for you to consider if they're not ongoing, if you wish to have another look at them and ask for further information. And obviously with the ongoing ones, you will see there is an update, a current update with each of the items to see what has happened recently. And also attached at Appendix 3 are the terms of reference for this committee, just to remind you what the remit for this committee is. So really it's over to the committee to see if there are any further items that you wish adding to work programme, and if there are any of the recommendations which you wish to further monitor if they're not already listed as ongoing.
Thank you, Paulina. I am conscious that recently Liz has, along with myself, we have sent the letter to Matt Hancock MP, so that will be updated on the report, won't it? I think at the moment it says ongoing.
Yeah. Well, it's listed as ongoing because obviously you'll be waiting for a response.
Okay.
Yes, so that will continue to be ongoing. We'll receive a response that will be reported back to the committee, and then you'll make further recommendations or not according to the response you receive.
Okay, that's fine. Does anybody else have any questions? Councillor Hemorrhage.
Yeah, mine was more about where I raised about little GP surgeries closing. Risk is, I mean, this is my risk. They say that they will reopen, but will they? And I don't know whether there should be a report on the work stream. I don't know if that will come into it.
What you mean with regards to whether it's going to happen or not?
Yeah, I mean, we know like with Palmwell GP surgery and potentially other surgeries, they've closed because of not having one entrance in and one entrance out. And Jan had said that this is only a short term because of COVID. But would there potentially that the GPs actually write to the CCG and say, actually, we want to close these surgeries? And we know that the CCG is moving to super hubs, so to speak.
Yeah.
So have we got the risk of losing all these little GP surgeries? And that's what my concern would be.
Yeah, I understand your concern, and I feel exactly the same way. However, Jess did say categorically there aren't any GP surgeries that have asked to close. I guess it will be up to us to keep a watching brief, and if we feel that surgeries do start to close, then we can ask for a report. In saying that, I would imagine that we will be updated on a regular basis. We always have a primary care report every year at Health Scrutiny, so we do have plenty of time to ask for a report. I don't think we're quite at the point where we would put a report on our work programme at the moment. Is that okay?
Yeah, no, that's fine. It's just that I know it's something to be watchful of.
Yeah.
People will say one thing and then the opposite happens, and that's what I'm concerned.
No, I'm sure we'll all keep an eye on something like that, because we all want the practices to stay within our areas for our residents. So as soon as something like that happens, we can soon ask for a report. So not a problem there. Any other questions from anybody? Are you all happy with the work programme and monitoring report? Yeah. Is that okay with you, Paulina?
Yes, that's fine. Thank you very much, Chairman. Thank you.
Okay, so now on to, if I get the right mouse. So if everybody's satisfied, that's fine. On to agenda item 10, the forward plan of executive decisions. Are there any items on the forward plan that the committee would wish to receive further information on? Please remember, though, that you can only request information from our committee, not from any others. And I understand that our items are on pages 120, 124 and 141. If there are any that people wish to ask to come to a future meeting, please put your hand up if there is something.
The urgent surge of community swabbing, are we going to be having that on the next committee member? Because obviously the COVID is increasing and we're having issues where people are getting tested.
Yeah, so training work programme.
Sorry, which page was that on? Which one was that, Councillor Hemraj?
120, the urgent surge of community swabbing service, delegation of function to Cambridgeshire County Council.
Is that something Liz could probably comment on at the moment?
Yes, this is one of those contracts that we're procuring jointly across Cambridgeshire and Peterborough, which gives us more procurement power. And my understanding is that we have a short-term contract which takes us up to the end of October, and this is swabbing for outbreaks. So it's if we have an outbreak in a workplace or a homeless hostel or somewhere like that, we can get in people quickly to swab, actually do the swabs. And then they send the swabs to the lab. And so we have a short-term contract, and this is about creating a longer-term contract to keep that service going, is my understanding. So,
are you happy with that, Councillor Hemraj?
Yeah.
Okay, so that's fine. Okay, so we don't have any other hands up, so we'll take it that nobody else wants anything adding and they're quite happy with the work programme as it is at the moment. So agenda item 11, committee can note future dates of our meeting. We have the 3rd of November for our next Health Scrutiny Committee and the 11th of November for the next joint scrutiny of the budget. And that's it. So thank you everybody for attending. Thank you for asking questions. I think it's been a really good meeting and it's given us a lot of information with regards to our current sort of situation. So thank you all. We might as well close the meeting. Thank you, Paulina. Thank you, Liz. And I'll see you all soon.